Hi everyone, my name is Neve and I'm the Health Promotion Officer for the hospitals in the Midwest region. I'm also a stop smoking specialist and I support both staff and patients at UHL to quit smoking. Today I'm going to talk to you about the importance of maintaining a smoke-free pregnancy and smoke-free home. So in the first half of today's talk, I will discuss maternal smoking, which includes the harms of smoking in pregnancy, the benefits of quitting for your pregnancy and beyond, the best way to quit, and the support that is available to access locally. In the second half of the talk, I will go through the different types of environmental smoke, the harms of exposure to you and your family, and how you can protect yourselves by keeping your car and your home completely smoke-free. The harms of maternal smoking are well known. There are harms during pregnancy itself, during infancy, and early childhood. Smoking increases the risk of complications of pregnancy such as miscarriage, placental abruption, and stillbirth, increases the risk of developing birth defects such as heart defects, which is increased by about 50%, and babies are twice as likely to be born premature or of a low birth weight. Sudden infant death syndrome or COTSET is 3 times more likely, and in infancy and childhood there is also an increased risk of chest and ear infections, asthma, learning difficulties, and ADHD. So what is it about cigarette smoke that is so harmful? Well, when you burn tobacco leaves, this produces smoke, and in that smoke there are a toxic mix of chemicals, such as those shown on the screen, and this includes things like carbon monoxide and tar. These dangerous chemicals cause the devastating and harmful effects on health. Now, nicotine is also present in cigarettes. Nicotine is a stimulant and it is very addictive. But it is important to note that it is not nicotine that is causing those smoking-related diseases like cancer and heart disease. In fact, many people use cleaner nicotine forms, such as nicotine patches or gum, to help manage those withdrawals and cravings that often occur when a person stops smoking. One of the most harmful chemicals in a cigarette is carbon monoxide. Carbon monoxide is a very harmful, poisonous gas present in cigarette smoke, and when inhaled can reduce oxygen levels in mum and baby. This can be quite distressing for baby, as the little developing heart will have to beat faster to ensure enough oxygen is being distributed around its body. This is the reason why we measure carbon monoxide routinely in your first antenatal appointment, as it is important that we identify if baby is being exposed to this toxic gas. Here's a brief video looking at the effects of carbon monoxide.
When a pregnant woman smokes or breathes in other people's smoke, she is inhaling carbon monoxide and many other harmful chemicals. These enter the bloodstream through her lungs and are then passed on to the baby through the placenta and umbilical cord. The poisons have multiple damaging effects, including restricting the flow of healthy, oxygenated blood and nutrients to the baby. They can also affect the child's intellectual development and stunt their growth. The only way to remove the risk is to stop smoking completely.
So now we're going to look at some of the benefits of smoking cessation. Look, there are a lot of benefits of quitting smoking, both in pregnancy and beyond. That carbon monoxide that we mentioned takes about 1 to 2 days to leave your body. So when you stop smoking, some of those benefits can happen quite early after quitting. In pregnancy, the risk of stillbirth, miscarriage, and other complications will be less. Baby is less likely to be born early and therefore less likely to have breathing and feeding issues or be admitted to a neonatal unit. There's also a reduced risk of developing chest infections and asthma as a child. In addition, there's a significant benefit on your finances. Cigarettes are pretty expensive. In fact, about 20 a day smoker could save about €7,000 in a year. And I think that would certainly come in handy with the arrival of a new baby. So when is the best time to quit? Ideally, the best time to quit is as early as possible into your pregnancy. But ideally, quitting before 15 weeks is beneficial and has been shown to reduce the risk of premature birth and a low birth weight baby to that of a non-smoker. However, giving up at any time during pregnancy will help baby by increasing the flow of oxygen to support their growth and development. So, what's the best way to quit smoking? Smoking is a complex physical and psychological addiction and a deeply ingrained habit. As a result, quitting smoking can be very hard for many and can take multiple attempts. Changing behavior is hard, and so behavioral support or counseling around how to address the psychological dependence and habit can be very helpful. In addition, because smoking is highly addictive, withdrawals and cravings when quitting can be unpleasant and can make the whole process harder. So, using something like nicotine replacement therapy can make the quitting process easier and should be considered if someone is struggling to quit. In fact, we know that combining those stop smoking aids with that behavioral support can make somebody 3 times more likely to quit. And your local stop smoking service provides both, and it's certainly going to increase your chance of success. Our local stop smoking service in the Midwest is called Quit Midwest. They offer stop smoking programs in a number of clinics across Clare, Limerick, and North Tipperary. They're a lovely team of experienced stop smoking advisors that deliver a flexible and non judgmental service. The program can be delivered over the phone or face to face, depending on your preferences, and it offers a program of behavioural support initially over the 12 weeks with follow up support at 6 months and a year if required. The service can also be used by partners or family members or indeed members of the public. So, how do you access support from this service? Well, you can talk to your midwife or GP, or you can contact the team directly by phone or email. And you can see the address there and the phone number on your screen. They will provide you then with the support that's available and they'll discuss the best options for you to take. So you might wonder, once you sign up to a program, what do you expect from that program going forward? Well, you will have regular contact with your own stop smoking advisor, and initially that would be quite frequent, maybe every week, and then less frequent over time if you're progressing well. At the first session, you might discuss your smoking history, whether you have quit before, how that went, what your goals are, and then you would co-create a plan of action with your advisor. They'll also measure your carbon monoxide levels and nicotine dependency, then that will help to inform your plan going forward. They may also have a conversation around managing your triggers, and that can be related to your environment, your routine, and sometimes even your emotions. They'll talk to you about how you might manage your cravings, for example, using strategies known as the 4Ds. Things like delay, drinking sips of water, distraction, or deep breath can be helpful. They may discuss the use of nicotine replacement therapy, so that's things like the nicotine patch and gum. And they will help you track your progress and help you problem solve along the way. Overall, really, they will just encourage you and help build your confidence and ability to achieve your goals. So I mentioned that NRT is sometimes used to support people to stop smoking. So what is NRT? Basically, NRT is a clean form of nicotine that helps to reduce cravings and withdrawal when somebody stops smoking. It doubles a person's chance of quitting. 1 or 2 products can be used, and the options include a patch, a gum, a lozenge, and a mouth spray. Now, this NRT or nicotine replacement therapy is typically weaned over 12 weeks, so you might start off at a certain level or a dose and then reduce the dose as the weeks go on. And then hopefully after 12 weeks, you'll come off the NRT completely. So you might be wondering, how do we know if NRT is effective and safe to use in pregnancy? Well, there's been lots of trials completed looking at this, and indeed a Cochrane review, which is quite a high level of evidence, was completed a number of years ago, and it was found that using a nicotine patch in pregnancy did not increase the risk of a number of adverse outcomes that you can see on your screen there on the right. So things like miscarriage, stillbirth, low birth weight, premature birth, and more. Nicotine replacement therapy is also recommended in national stop smoking guidelines for pregnancy. So it is recommended that if you are interested in using NRT, please speak to a member of the obstetrics team or your GP who can discuss the risks and benefits. Now we're going to move on to the next section of today's talk, and I'll speak about environmental smoke, the harms of exposure, and how you can protect yourself and your family. So environmental smoke includes both second and third hand smoke. Second-hand smoke is that smoke that is breathed in from other people's tobacco smoke. So it can come from the smouldering end of a cigarette in between puffs, or the smoke that is exhaled by the smoker when they're smoking. Now, third-hand smoke also exists, and this refers to the smoking particles that can then stick to the surfaces, and they can also become resuspended later in the air. So sources would include things like furniture, clothing, smokers' hands and face. And this residue becomes increasingly more toxic with time, and it can be a big problem, especially for children in exposed homes, because those particles can be re-emitted back into the gas phase, react with oxidants and other compounds in the environment to yield secondary pollutants. Now, children and infants are more vulnerable to the effects of these particles. And the reason for that is they have faster respiratory rates, they have narrower airways, and their immune systems are just less developed. There are many ways that babies and children may be exposed to the harms of tobacco smoke. So we saw earlier, there's exposure during pregnancy if there's maternal smoking, because that toxic tobacco smoke chemicals can cross the placenta and pass from mother to baby. Also, after birth, breast milk can transfer tobacco smoke chemicals from mother to child. In addition, people who smoke might carry that toxic residue that we mentioned on their skin, hair, and clothes, which the newborn child can breathe in or swallow. And finally, children can actually re-volatilize smoke and smoke particles from surfaces like the floor or furniture through active play. The impacts of secondhand smoking is pretty well known, so let's look at some of these common health risks. We know that it increases the risk of cot death about threefold. In fact, 1 in 5 cot deaths are thought to be directly due to tobacco smoke exposure. There's also an increase of developing things like meningitis, ear infections, coughs, colds, and chest infections are increased by about 50%. There's an increased risk of developing asthma or indeed exacerbating a pre-existing asthma. And the risk of developing smoking-related diseases like lung cancer or cardiovascular disease later in life is increased by about 30%. And finally, children are about 4 times more likely to take up smoking if they're exposed to smoking in their home environment as a child. So the key message is that the best way to protect your family from second-hand smoke is to keep your car and your home completely smoke-free. So what is a smoke-free home? This is important to mention because people may say that they don't smoke around their kids, but they do smoke in the house when the kids are out, or they might smoke in another room. And there are some misconceptions that this protects children, but unfortunately it doesn't. So correcting these misconceptions is really important. Other examples are that things like using an air freshener or opening a window might remove the risk, but we know that smoke can actually travel from room to room, and it can linger for about 5 hours after smoking. So even though you might not be able to see it or smell it, it's there and it's causing an effect. The same applies to cars, so best to avoid smoking in both your car and your home to protect your kids and other household members. So if you currently allow smoking in your home and are keen to transition to a smoke-free household when baby is born or even sooner, there are a couple of things to keep in mind. It's helpful to be upfront with people and tell people that smoking is no longer allowed in your home and why this is the case. Explain that when baby comes home, you've decided that you want your home to be completely smoke-free to help protect baby and everybody else in the family. There's also leaflets available that might be helpful. If somebody currently smokes in the home, it might be helpful to remove ashtrays, lighters that might be lying around and ask the person to smoke outside. I would encourage the use of a coat by the door that's used for smoking only, which will then be removed when the person enters the house after having a cigarette. Also, it's a good idea to wash face and hands after having a cigarette because you don't want to pass on those chemicals on to baby. Finally, it might be hard for some people to smoke outside because they might live in circumstances where it's not easy to access outdoor space, for example. And so in this instances, I would encourage people to use things like nicotine replacement therapy, so like a piece of nicotine gum, to help manage the cravings during those periods. So the key messages to take home from today's talk is that there really is no safe level of exposure to smoke. The best way to protect your family is to keep your car and your home completely smoke-free at all times. For those who smoke, we know that quitting smoking has huge benefits, but it's often very difficult to achieve. So getting support will really increase your chances of being successful. And that support is available locally. It's free. It's a non-judgmental, flexible service. It's tailored to the individual needs and the preferences of the person who uses that service. It's also available for partners and family members, so please spread the word to anyone that you know that might be interested. And if you have any questions around today's talk or want some more advice around quitting smoking, contact the local Stop Smoking service on the number on the screen, or you can talk to your GP or midwife. And there's some really great leaflets available as well if you want some more information. Search healthpromotion.ie, or indeed you can scan the barcodes that are on your screen. And finally, all that's left to say is thank you so much for listening, and I wish you all a very healthy and safe pregnancy and delivery. Thank you.